Thank you, Chairman, and thank you, Minister, for attending today. I have 4 questions. I'll try and get through them quickly. We've just 5 minutes. First one, a colour-coded alert system has been introduced as an alternative to the previously published roadmap for reopening. Does your department have a date for the publication of this system? What can the public expect from this system, and will there be restrictions tied to specific colours, etc.? Secondly, data in relation to hospital-acquired COVID-19 infections was released at the end of June. There were 265 cases of hospital-acquired infections, so about 8% of all hospitalised COVID-19 cases. The latest data from the Health Protection Surveillance Centre has identified 8,563 COVID-19 infections in healthcare workers, which is about 31% of all COVID-19 cases. As we move into a potential second wave of COVID-19, what work is being done to reduce the spread of COVID-19 within our healthcare facilities? Will there be a lessons learned report on hospital-acquired infections and the high levels of COVID-19 infections among healthcare workers? Thirdly, how is your department ensuring there is a minimal disruption to medical services in the event of a second wave? Is your department considering using the private hospitals as we have previously done? And my final question, Minister, in their meeting on Thursday, 6th of August, NPHET discussed alternative testing pathways for children. The standard nasopharyngeal, oropharyngeal specimen is upsetting and off-putting for many children and their parents and guardians. The alternative, less precise oral fluid or saliva specimen was discussed in recognition of this being more appropriate for children. Could your department clarify if you have received recommendations from NPHET on alternative specimen types for testing children? As we move closer to the reopening of schools, could your department prioritise this issue? Thank you.
Thank you very much, Deputy. To be clear, the colour coding system is currently a proposal from the National Public Health Emergency Team. It's for consideration at a government level. Government is currently putting together the new detailed roadmap, and that will be available for debate and discussion with the Oireachtas in the coming weeks. But regardless of what is decided in terms of the new roadmap, between now and Christmas, we're essentially in a new chapter. And the strategy is this: follow the public health advice, suppress the virus to keep society and the economy open, use localised approaches where we can, and thanks to the people of Laois, Kildare and Offaly, we know work, and critically target the measures at the areas and the activities where we know the virus spreads in order to protect everything else in our society and economy staying open. With regard to healthcare workers and infections, I agree. It looked and looks like a very high number. Any healthcare worker who's infected is one too many, quite frankly. And at the start of this, there is no doubt but that the level of infection prevention and control measures now in place was not in place. That's not a criticism of occupational health or the amazing healthcare workers around our system. It's a novel virus. It hit us very quickly. We hadn't dealt with anything of this scale before. I can assure the Deputy that very, very rigorous infection prevention and control measures are now in place. However, we must never stop and say that this is enough. We have to keep going every day, every week, and tightening up on the protections, not just for our healthcare workers, but for our patients, not just for those working in the nursing homes, but for the residents and so on. Deputy, you ask a very important question that weighs on my mind a lot, which is what happens to healthcare services if there is a second wave? The short answer is nothing good happens. As we all know, before COVID arrived here, we had the longest waiting lists anywhere in Europe. And the new information on how long they have now become because of the elective care that had to be paused is very, very sobering reading. One of the reasons the winter plan that we are going to propose is so comprehensive is to be able to deal with COVID and have surge capacity, be able to get the healthcare system running to deal with day-to-day demand, and ideally start looking at these lists as well. Of course, we will minimise the disruption to healthcare, but let's be very clear. If we are dealing with a serious second wave of COVID in this country, healthcare services will, for a second time, be severely curtailed. It's why, Deputy, the message is so important for us to get out right now, that we are at a tipping point. If we all comply with the healthcare advice from NPHET, as the people of Kildare, Laois and Offaly have shown, we can suppress the virus. The best way we can all protect healthcare workers, the best thing we can do to make sure that our hospitals and our community settings stay open, is to suppress the virus in the community. And I'll get you a written response, Deputy, in terms of the saliva test. The short answer is yes, it has been discussed by NPHET.